As the FDA researches psychedelics to treat mental illnesses, our generation is calling for them to be decolonized. I'm Yoonj Kim, and this is MTV News Need to Know. Cybin is a biotech company working on a fast-acting treatment for depression using psilocybin, the magic behind magic mushrooms, and a budding billion-dollar industry. Last week, it became the first psychedelic therapeutics company to list in the New York Stock Exchange. But are we doing enough to make sure that the traditional cultures behind these medicines are included in this growing field? This is all happening as there's growing support in pop culture. Last week, Casey Musgraves spoke openly about using psychedelics recreationally on the podcast A Slight Change of Plans.
I just think that ultimately psychedelics, one thing that I love about them is that they cause death to the human ego. And the human ego has caused so many problems over time. I mean, it's like it puts things into perspective.
Psychedelics have been used medicinally in indigenous cultures for centuries. And in fact, over 40% of Western pharmaceutical drugs come from plants used by indigenous people, including aspirin. During the war on drugs in the 1970s, research into psychedelics was criminalized, but in the 2000s, it picked up on a small scale, and like weed, psychedelics, especially psilocybin, are seeing renewed attention today. Researchers say they're potential game changers to treating mental illnesses like depression and PTSD, and that's why some lawmakers like California State Senator Scott Wiener are calling for change. We'll continue to push to decriminalize psychedelics in California. The war on drugs is a failure, and these particular drugs have huge promise in treating mental health and addiction disorders. Big Pharma has failed to make major medical gains in mental health treatments over the past half-century, as last year, youth suicide and overdose rates hit a record high. And as millions continue to live with mental illnesses, psychedelic therapy could be one solution. And psilocybin is close to FDA approval for severe depression. This is the result of the work of nonprofit organizations like MAPS to research and destigmatize psychedelics. But as the field gains legitimacy and funding, we are seeing a corporate race to patent novel uses of psychedelics. For example, Compass, backed by billionaire Peter Thiel, made a patent claim for everyday practices like holding hands and using soft furniture. And if this sounds wild and nonsensical, it's because it is. And this is the problem with monopolization. It lets companies charge whatever they want, as we're already seeing with other life-saving medications like insulin. And patenting plant medications continues a cycle of biopiracy, which means exploiting or monopolizing plants without compensating indigenous people. And much of America's understanding of magic mushrooms was introduced by a Mexican healer named Maria Sabina, who died penniless, even though she helped popularize shrooms in America. And so as steam picks up, many are fighting to prevent the market from mirroring the marijuana industry, which is ruled by a few giant corporations, cutting out farmers and indigenous people. And today, 80% of participants in clinical trials for psychedelic mental health treatment are white. This is why researchers are calling to decolonize psychedelic business models. And right now, states like California and New Jersey are attempting to decriminalize psychedelics. Oregon has already done so, but in moving forward with FDA approval, writer Carolyn Gregoire reminded readers in Neolife that without a commitment to equal access, critics say that the mainstream adoption of psychedelic medicine may perpetuate systemic inequalities and create barriers to access for people of color as patients, therapists, and stakeholders in psychedelic businesses. As FDA approval appears imminent, it's important to remember how interconnected privilege is to everything in our healthcare system. Whether you need psychedelic therapy or life-saving medication, the reality is that our structures exacerbate racial and class gaps, and we must dismantle them. Because as magical as mushrooms are, legalization is just one part of the healing process. I'm Yoonj Kim, and that's what you need to know.